Welcome to Med Madness, the podcast that takes you deep into the world of medical knowledge, helping you prepare for exams and clinical practice. Today, we're diving into a critical topic for all medical students, preeclampsia. This condition is not only a common complication of pregnancy, but also a significant cause of maternal and fetal morbidity and mortality. In this episode, we'll explore what preeclampsia is, its causes and risk factors, symptoms, diagnostic methods, and treatment options. We'll also discuss a real-world case study to illustrate these points. So, let's get started. Preeclampsia is a multi-system disorder that occurs during pregnancy, typically after 20 weeks of gestation. It's characterized by new-onset hypertension and proteinuria, or in some cases other signs of organ dysfunction such as elevated liver enzymes, low platelet count, or renal insufficiency. The exact cause of preeclampsia is not fully understood, but it is believed to be related to abnormal placentation and the resultant endothelial dysfunction. Risk factors for preeclampsia include a history of the condition in previous pregnancies, chronic hypertension, diabetes, obesity, and maternal age over 35. It's crucial to understand the pathophysiology of preeclampsia to manage it effectively. The condition begins with the poor trophoblastic invasion of the uterine spiral arteries, leading to inadequate placental perfusion and ischemia. This ischemia triggers the release of anti-angiogenic factors into the maternal circulation, causing widespread endothelial dysfunction, vasoconstriction, and hypertension. Patients with preeclampsia may present with a variety of symptoms. The most common are persistent headache, visual disturbances, epigastric or right upper quadrant pain, and sudden weight gain due to fluid retention. Some patients might also report nausea or vomiting, shortness of breath, or a sense of malaise. Clinically, the condition is diagnosed when a pregnant woman has a blood pressure reading of 140 over 90 millimeters of mercury or higher on two separate occasions at least 4 hours apart, and proteinuria defined as 300 milligrams or more of protein in a 24-hour urine specimen, or a protein to creatinine ratio of 0.3 or higher. If proteinuria is not present, the diagnosis can still be made based on other signs of end organ damage. Diagnosing preeclampsia involves a combination of clinical assessment and laboratory tests. Regular prenatal visits are essential for monitoring blood pressure and detecting proteinuria early. If preeclampsia is suspected, additional tests may include a complete blood count, liver function tests, and serum creatinine levels to assess for hemolysis, elevated liver enzymes, and low platelets, which is a severe form of preeclampsia. Imaging studies, such as ultrasound, are used to evaluate fetal growth and amniotic fluid levels, as fetal growth restriction can be a complication of preeclampsia. Doppler studies of the uterine arteries can also provide information on placental blood flow. The management of preeclampsia depends on the severity of the condition and the gestational age of the pregnancy. For mild preeclampsia, close monitoring with frequent blood pressure checks, urine tests, and fetal monitoring is usually sufficient. Patients are advised to rest and reduce physical activity. For severe preeclampsia, hospitalization may be necessary to manage the condition more aggressively. Antihypertensive medications such as labetalol, nifedipine, or methyl-dopa are used to control blood pressure. Magnesium sulfate is administered to prevent seizures, a condition known as eclampsia. In cases where the disease is rapidly progressing or the health of the mother or fetus is at risk, early delivery of the baby may be necessary, even if it means preterm birth. It's important to note that while delivery is the definitive treatment for preeclampsia, careful postpartum monitoring is essential as the condition can worsen after childbirth. Let's consider a case study to illustrate these points. A 28-year-old woman pregnant for the first time presents at 32 weeks of gestation with complaints of severe headaches and visual disturbances. On examination, her blood pressure is found to be 160 over 100 millimeters of mercury, and urine dipstick analysis reveals significant proteinuria. Blood tests show elevated liver enzymes and a low platelet count, indicating the presence of HELLP syndrome. The patient is admitted to the hospital and started on antihypertensive medication and magnesium sulfate. Despite medical management, her condition deteriorates, and an emergency caesarean section is performed to deliver the baby. Both mother and baby require intensive care but eventually recover well. In summary, Preeclampsia is a serious pregnancy complication that requires early detection and careful management to ensure the best outcomes for both mother and baby. Understanding the risk factors, symptoms, diagnostic methods, and treatment options is crucial for all healthcare providers. Remember, the key to managing preeclampsia is regular prenatal care and early intervention. Thank you for joining us on this episode of Med Madness. Don't forget to check out our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Stay tuned for our next episode and keep striving for excellence in your medical journey. Thank you for listening to Med Madness. Be sure to subscribe to our podcast and follow us on social media for updates on new episodes. If you have any questions or topics you'd like us to cover, feel free to reach out. Until next time, stay curious and keep learning.